Okay, we're going to take a look at Chapter 8 in the textbook, Preparing Health Professionals for Diversity Care. Some objectives to keep in mind throughout the lecture. We should be able to identify different diverse groups by the end, discuss best practice for providing patient care to patients with alternative sexual orientation or identity, describe socioeconomic status and how to avoid stereotyping within this group. Lastly, identify different cultural backgrounds and how those backgrounds can impact healthcare delivery. You're all well aware that there are many differences between every individual within this world. We are taught and shown starting at a very young age about diversity and how those differences make us unique and special in our own different way. Healthcare is definitely no stranger to these terms, and oftentimes individuals working in healthcare need an extra information session or a little learning activity to better prepare them for caring for others of different races, ethnicities, cultures, genders, and statuses. This lecture will help you as a student and healthcare professional or technologist to better handle healthcare situations in which the patient has a unique background from yourself. We encounter all types of people within healthcare, so the three main groups that we're going to focus on in this lecture are gender characteristics, socioeconomic characteristics, and cultural characteristics. We will briefly discuss, and in some cases in a little more detail, cover the following groups and hope to prepare you for caring for such individuals. Start by touching on gender differences. Male versus female. We're well aware of these general differences. We have often been exposed to these typical stereotypes regarding these two in the healthcare setting. Just for a little bit more detail, we will go into characteristics that set them apart. So, for instance, women are considered to have a bad sense of direction, while males are known to mature later in life. So many of these stereotypes have been proven, but they're not accurate in all cases. So your book touches on cognitive abilities and personality traits, the differences between the two, and just having this general background can help you care for these individuals that much better. When it comes to intelligence, achievements in life, the book is taken into consideration test scores, levels of education, how a person speaks and interacts with people. So all this has to do with the brain function, and there's many differences between male and female. A very interesting chart is in your textbook on page 284. It says the gender differences in brain structure. So there's different brain structures listed and what they control, and then it compares male and female. Kind of get a gist of how they've come about seeking these traits. So when it comes to personality, I think this is a much larger one that we would need to touch on in the healthcare industry. It touches on emotions and aggression and behavior, which are very important to know because in a healthcare setting, these emotions and aggressions can be heightened due to the level of uncertainty from the patient. And being a healthcare professional, you should be aware that these emotions might come out. You have patients that are angry or they will cry. So being knowledgeable about these certain behaviors is important to provide good patient care. Deeper into the gender characteristics, we have gender identity and orientation. This is a topic healthcare professionals need to know about and how to care for individuals of the LGBT community. That meaning lesbian, gay, bisexual, and transgender people. This community can face many hardships in life, so as healthcare workers, we should try to put them at ease when they are in our care. LGBT community often face stigma, barriers, and access to adequate healthcare because they are included in this group. As healthcare professionals, we should make it our mission to establish a professional patient to healthcare worker relationship and make that patient feel comfortable. They have little to no health coverage, limited resources available to them, and negative interactions with previous healthcare providers. That's huge when everybody needs health care and treatment from time to time. So if they experience that negative interaction in the past, they're more reluctant to seek it in the future. So we should make it our mission to dissolve that negative interaction and establish a good relationship with open communication, because that's the only way that we're going to be able to help them. Additionally, it's difficult for healthcare professionals. When patients feel that negative interaction, they may be reluctant to share or disclose important information regarding their health. I feel like we've all seen it before, where a nurse or a provider comes up to you and says something, the patients have X, Y, and Z, and then you go in and maybe you establish that relationship, and that patient is more open to communicating, and they're like, well, this is what's really going on. So it can vary between healthcare professional to professional, but in the end, we all need to get on the same page and establish that open communication and relationship with everybody, regardless of what diverse group that they are included in. There are some things to keep in mind when you're working with somebody of the LGBT community. Obviously, be welcome and understanding. That goes just about with any patient. Gather information, like we talked about the last slide. You want to form that relationship so they're more apt to tell you what's going on and what's concerning them. Ask questions that are open-ended, like how can we better assist you? How can we make you feel more comfortable? Give them that option to tell you how to help them. Another one to keep in mind is never make assumptions based on their appearance, whether it be their hair color, style, if they have tattoos or not, how they're dressing. You never know what somebody's going through, so the way that they express themselves is and can be quite different from the way that you. And again, communication. Healthcare, I feel, basically comes down to communication. So making that relationship open, that's how you're going to get the best and from them. And if you're working as an imaging technologist, communication is key. If you want a person to hold a certain position, telling them how to do that, they're more apt to help you. Okay, moving into the second diverse group we're going to talk about is socioeconomic status. This has a lot to do with the classification of individuals about certain measures, certain things that they have or they don't have. So a lot that is looked at within this group is their income of their parents, their wealth status, how they exhibit their wealth, education, occupation, where they live. A lot of this plays into where somebody is essentially within this group or status. And in healthcare, we see a broad range of these types of patients, and we need to know how to handle them and not stereotype them based on where they are in this group or any other characteristic. Characteristics that we discussed last slide, like education, wealth, occupation, they all have a tremendous effect on health status and behaviors of individuals, whether they are in poor status or wealthy status. So one touched on here is the cycle of poverty. It's believed that generally it describes that families of lower income or education tend to live in lower income areas. Their children will grow up in these lower income areas with the lower or poor education and eventually cycle back around and see their parents living, and that's how they tend to live. So it's this repetition and cycle within this group. Another aspect brought along with this is healthcare literacy. Now, this doesn't just pertain to people that are classified as a lower or poor status, but it can be across the board. Having that knowledge or education regarding wellness, disease, or treatments is power. You know, many people are taking medication, or they don't know why they're taking the medication or what kind of illness that they have. So it's important to be, as a healthcare professional, educating these patients regardless of status so that they can better themselves. Lastly, we move into cultural groups. I liked this quote from our textbook saying, health professionals need to have sound knowledge of the cultural values and beliefs of specific ethnic groups. While it's impossible to know every ethnic group out there and all of their beliefs and everything, it is important to be sensitive and to know certain terms regarding those groups. Here are some terms that you probably already know, but they're just important refreshers. Culture, ethnic group, and one that I really liked was cultural awareness. I feel as health professionals, we all need to be aware of different cultures around us because we're treating people day to day with different cultures. So it's just recognizing diverse groups, whether it be their physical features, what they're interested in, how they interact with you as a healthcare professional or their family. It's just all very good to observe as that healthcare professional. When we think of sensitive care and delivering sensitive care, it makes me think just taking a moment to step back, realize what's going on, the situation, and acting accordingly. It's imperative that we as healthcare professionals never try to push a treatment or procedure on others because they might oppose that for cultural or ethnic reasons. And the only way to tell that is through communication with these individuals. On the previous slide, I listed some considerations, and here I just kind of expand on them a little bit. Like I always said, communication is key, especially within different cultures. You're going to experience language barriers, whether that person is deaf and they need sign language or of a different language speaking wise. So many hospitals and healthcare facilities can have interpreters or special computers where this interaction can take place. Another thing to keep in mind is your expression and attitude. People can pick up on, when they're not being listened to and everything. So it's really important to harness that in and be sensitive to that. When it comes to treatment, some cultures have restrictions. They, like for instance, some cultures see a blood transfusion as a very negative thing that they cannot do. So it's just being knowledgeable about that type of situation. Spiritual beliefs, you'll have some patients' family in there praying. They have certain traditions that you should be mindful of. Family order. There can be a hierarchy like the patriarch of the family, matriarch of the family, and how those family roles play into healthcare. And lastly, nutrition. They can have limitations apart from allergies that their culture just does not eat, or some that sees nutrition as a delicacy. I have a link here to an article I thought was very interesting. It's kind of lengthy, definitely don't need to read it all, but on the second page of the article, it had a chart that listed socioeconomic status and how there were strengths and limitations to those specific topics like education, occupation. It was just an interesting read if you want to check it out. And to wrap it up, the assignment for this lecture is just a short reflection, basically telling about a time that you encountered a patient or individual that fit one of these diverse categories and how you reacted. Did you think you could have done something different? Did you think it went good? What could you take out of that interaction that maybe could help others in the future, or that you can see as a fault and expand on and improve in the future? And to wrap it up, here are some references used for this lecture.